My name is Steve Hollon. I'm a professor of clinical psychology at Vanderbilt University, and it's my great good pleasure to be invited to attend the 26th annual Australian Association for Cognitive Behavior Therapy this coming October in Melbourne, and then to be followed up by a series of workshops in leading cities across the country. I'm a longstanding devotee of cognitive therapy. I had the great good fortune to train with Aaron Beck and colleagues back in the mid-70s in Philadelphia. But what I will say is that cognitive therapy has evolved in recent decades in a way that allows it to be more effective with patients with chronic and especially comorbid disorders secondary to personality disorders. The main thing that's been the basis of that evolution is the notion of a three-legged stool. Rather than simply addressing current life situations as we always have done, we now bring in attention to a second leg, which is the earlier childhood events that help develop the risk for depression, and using the therapeutic relationship as the third leg to facilitate working in a different way with interpersonal relationships. I want to illustrate that in particular with two clients, one a relatively straightforward but severely depressed client with no other prominent comorbidities. And the second, a woman that I treated in our Penn Vandy study who had depression superimposed on a long-standing history of trauma and personality disorder. The first fellow moved much more quickly to therapy, conventional case. The second lady took considerably longer, but I learned a great deal in the process. It's the kind of thing we tried to build into the very recent revision of the Cognitive Therapy of Depression manual, the 2024 revision. And I'll use both the clinical examples, case material, and a bit of videotape, plus role plays in the sessions to try to communicate those points. I look forward to seeing you in Melbourne and the other cities in the workshops, and I look forward to seeing you in October. Thanks now. Take care.